Sorry, I'm letting people come in from the waiting room. Great. I know we're expecting more, but for the sake of time, making sure we do end on time, I will go ahead and get started. Good morning, everybody. My name is Maria Thacker-Gothi. I am President and CEO for Georgia Bio and CEO for the new Center for Global Health Innovation. We're very excited to have you here for this very important conversation as we are coming closer to the dreaded flu season, knowing that we could potentially have a twin pandemic on our hands. It's an important conversation, and we look forward to hearing from our experts today. A few housekeeping items. I encourage everyone to submit any questions they may have in the Q&A box at the bottom of their screen. And we will do our best to answer as many questions as possible. Should we get through them and be able to end early, we will. But if we aren't able to get through them all, we'll do our best to follow up via email on anything. A couple housekeeping items, a couple upcoming event items that I want to bring to your attention for Georgia Bio. Next week, we will be having a program on our labs and reopening labs. I know many labs are already reopened, but the reality is this is a constant, we are still dealing with COVID and things change rapidly. So reassessing how we're keeping our employees safe and our team members safe is important, as this continues to be a moving target and something that we need to be mindful of and not let our guard come down. Most of our team members and most of our employees are essential workers. So we want to make sure we're being as safe as possible. So please join us next week for our lab program. And we will drop a link into the chat directly to that event. Additionally, I invite you to save the date for our first ever Patient Advocacy Summit on September 22nd at 10 a.m. That event will welcome some esteemed speakers, and we'll host a few panels as well, conversations with a physician and a patient, for example. It will be very focused on equity and diversity in trials as well. So please do save the date for September 22nd, and we will be sending out a lot more information about this next week. This is a free event to patient advocates and a negligible cost to many of our industry members, but this is an opportunity to make sure that we continue to make all of our research developments patient-centric and involve them at the front end of innovation. And then finally, I invite you to save the date for our annual conference, which will be virtual, November 4th, 5th, and 6th. November 4th and 5th will be our core programming, and we have some we will be welcoming Dr. McMurray Heath, the new president and CEO of Bio, as one of our keynotes, and we'll roll out some new keynote speakers coming soon as well. I am very happy to say we'll have partnering, and on day 3 we'll have a lot of workforce work, and knowing that we begin the day after the presidential election, we will be waking up early in the morning and offering some mental health wake up experiences, whether that be a bar class or meditation or yoga. So I know that'll be stressful for everybody, no matter what end of the aisle you fall on. So we do invite you to join us for our conference, but wake up the day after the election and have a little bit of mindfulness for yourself. So with that, let's go ahead and turn to our panel. Again, I'm very excited to have everyone here with us today. And we have a number of things we could cover. As we know, the potential for co-circulation of flu and COVID-19 is very much a reality for all of us, and we pulled together an esteemed panel here. So with that, I'd like to invite each panelist to introduce themselves. So Michelle, could you introduce yourself and your organization?
Sure, thanks so much for having me. My name is Michelle Cantu, and I'm the Director of Infectious Disease and Immunization at the National Association of County and City Health Officials, or NACCHO.
Thank you. Heather? You're on mute, Heather.
Okay, try this again. Hi there, I'm Heather Richmond with Securus. We are influenza vaccine manufacturer, and I do policy for the Americas.
Excellent, thank you. LJ?
Good morning, I'm LJ Tan. I'm the Chief Strategy Officer for the Immunization Action Coalition, and I'm delighted to be here. Thank you so much.
Thank you, LJ. And Amy?
Hi, Amy Walker. I'm the Director for Infectious Disease Policy at the Biotechnology Innovation Organization, or BIO.
Great, thank you. So I'm going to invite the other panelists to turn their videos off and ask Michelle to, tell us a bit about what she's seen over in her organization and give us a short presentation. So, Michelle?
Sure. Thanks so much, Maria. And just as I realized I didn't really provide that much information about the National Association of County and City Health Officials, or NACCHO, but we are a membership organization that's comprised of nearly 3,000 local health departments across the country. And our mission is to serve as a leader, partner, catalyst, and voice for local health departments. So what that really means is we're working in the public health space, and our work really covers the gamut of advocacy to funding, networking, partnerships, training and education, and providing technical assistance for local health departments through the development of timely tools, resources, and publications to really move local public health forward. So just kind of a bit of background and what we've been seeing over the last couple of months. At the National Association of County and City Health Officials, we do have a profile study that is conducted every 3 years that provides information about what is happening at local health departments. And the reason I bring this up is because what is happening related to workforce, funding, governance, and those activities to support immunization, particularly influenza into this year, have been impacted by COVID-19 this past year. And we have seen this not only through recent MMWRs, but also in some data that I'd like to share with you all as well. Before I do that, just one of the other things that I wanted to talk to this group about related to health departments and particularly local health departments is that one of the most common clinical program and services provided across local health departments is immunization. And we know that about 88% of all local health departments provide both adult and child immunizations, regardless of whether they are in various jurisdictions or whether they're in urban or rural settings. Oftentimes we think of local health departments as chief health strategists within their communities because they are in a unique position as living and working within the communities that they serve. They can be key community stakeholder conveners where they work with healthcare providers or industry leaders or schools or daycares or et cetera, just depending on whatever sector you're in to really address any public health issue. And we know that local health departments are really providing immunizations across the lifespan. They also conduct a lot of education and provider outreach, and they also conduct many communication campaigns specific to immunization, but also influenza. Now, over the last couple of months, NACCHO really wanted to learn a bit more about the impacts of COVID-19 on health department immunization programs. And so we did do a small convenience sample in the month of May, just to kind of get a glimpse of what was happening on the ground. And what we learned was that nearly 90% of respondents indicated that immunization programs and services have been impacted by COVID-19. And some of the most frequently reported activities that were altered included the provision of clinical services, education and outreach, training, partnership activities, vaccine for children related activities, school assessments, even surveillance and outbreak control efforts for other vaccine preventable diseases. And a lot of that was due to the program staff that had to be reassigned due to local health departments' response to COVID-19. So the majority of immunization program staff have had to redirect their efforts to be able to support the activities of the local health departments. So what does this really mean, and how does this affect our influenza season this year? And what that does say is, even before COVID-19, we knew that local health departments' workforce capacity was dwindling. And what we have seen in some of our data is that LHDs, or local health departments, have lost 21% of their workforce capacity since 2008. And this really hinders the timely and robust public health response to COVID-19. And in addition, we know that there have been budget shortages that have really affected the way in which health departments' emergency preparedness and response programs have been able to respond to COVID-19. So that requires other programmatic staff to come in and help support those response efforts. So local health departments are really trying to balance their response efforts to COVID-19 as well as providing essential services like immunizations currently. Now, as we know, we're preparing for influenza season, and we know that right now the presence of COVID-19 and influenza at the same time could place a huge increased burden on our healthcare system and further result in taxing our hospitals, our clinics, and our workforce. The way in which various states have reopened, schools have reopened, and the way in which we're coming back together really does highlight the need for immunizations. And we know that vaccine is the best way to prevent influenza and its complications. So local health departments have really been preparing for influenza season, and they have done this by even the things that they've been doing over this past couple of months, which is exploring innovative and redesigned methods to continue offering vaccination services and counseling during a time of social distancing and even stay-at-home orders. So they've adopted alternative service strategies, including adjusting clinical hours and appointment schedules. They've adopted online and telehealth services to offer immunization education and counseling, which is essential to promoting vaccine confidence. They've conducted home visits or drive-through or curbside vaccination clinics to maintain social distancing guidelines and accommodating stay-at-home orders. And they've addressed patient safety concerns by conducting pre-screening before a clinic visit and outreach via telephone and social media to inform patients about clinical protocols that have been put into place to mitigate the risk of COVID-19 during a clinic visit. We know that there's been so many good examples from states like Tennessee and different examples of work that's being done in different local health departments across the country. In addition to all of these kind of administrative approaches to providing influenza this year, health departments are also expanding partnerships with key stakeholders in their community and working with communities to engage conversations about flu and flu vaccine during a time of COVID, and developing tailored, culturally and linguistically responsive messaging, explaining health risks posed around influenza and really honing in on the benefits of vaccination. During this time, NACCHO is going to continue to provide support for health departments through webinars featuring experts in the field such as CDC and other immunization and preparedness staff members at health departments to share resources. We are saving recordings, our slides and FAQs and resources on our website. We've also started to collect stories from the field from other health departments to really share best practices and lessons learned about what is happening currently. And we also are promoting reports and also our policy statements on influenza vaccination for healthcare personnel and school and child care immunization requirements. We know that this is an incredibly important year, and what has happened in the Southern Hemisphere, I think, can be taken with a note of caution. We recognize that there were community mitigation efforts taken and put into place, as well as vaccination, and we have to think about what is happening now within the Northern Hemisphere, the ways in which we've reopened, the ways in which schools are engaging again, and being very careful in terms of how we look at that data previously. You know, I think that health departments are really geared up to try to support the efforts for influenza this year, and NACCHO is very much ensuring that we're supporting them from the kind of resource and policy angle. I think that I can pause for questions or perhaps pass it on to the next panelist.
Yes, sorry, I had to make sure I was muted on my audio. Unmuted, excuse me. So that was really interesting. Thank you for that, those remarks, and we will circle back to some questions in a minute. But I wanted to move to more of an industry perspective and invite Heather to make some opening remarks. Are you good with your connection? I know you have storms. Okay, great. Unmute. There we go.
All right, can you hear me now? Sorry about that. I am having a little bit of a difficulty. So sorry, bear with me. Thank you again for this opportunity. And I wanted to come to this discussion to focus on what's happened in the Southern Hemisphere, particularly in Australia. As we all know, Australia did just finish their influenza vaccination season, and they were able to accomplish an amazing amount of vaccines and immunizations during this pandemic. I'm just going to give you a little bit of background on what the country did, and then some of the activities that they undertook to reach amazing amounts of high-level rates. So the country actually started their state and country border closures, as well as quarantine and social distancing efforts, by the third week of March. So they started some, you know, really mitigating some of the spread of the virus quite early on. Additionally, to reduce the burden on the healthcare system, the government issued very distinct policy changes to influenza immunization. So they changed the time and the work burden on healthcare providers. They mandated influenza vaccine for anyone entering a long-term care facility or nursing home facility, and they put a date to that. So they actually made that 1 of May. So that anybody working, entering, living in one of those facilities had to have an influenza vaccine. They also extended the recommendation. It wasn't a requirement, but a recommendation for all daycare facilities. And that was actually reinforced by April 1st. So while the US has a universal recommendation for every individual in the country, Australia has recommendations for certain populations. But because they wanted to get as many people vaccinated to protect against influenza as possible, they did recommend, some of the states recommended expansion to primary school children, and that was funded through the government. So children ages 5 to 12 years old were recommended for vaccination. So there were very distinct policy changes that the government undertook, and that really advanced their opportunity to immunize as many people as possible. The local authorities and the national authorities, particularly the Ministry of Health and the Chief Medical Officer, were very, very vocal through media, pushing out messages through their own web pages, through newspaper and TV and radio. The messaging was very consistent, which is very important when you're trying to encourage people to get their vaccine and during a pandemic. And they were able to work both at the state and territory, work with state and territory leaders to continue that messaging down to the very much a local level. What's really important to remember about Australia, or to think about Australia, that even though the country had very strict orders on movement between states or outside of the country, and they did affect social distancing measures, the government still encouraged people to seek preventative healthcare services. So while we did see social distancing, there was a large encouragement to go out and still get your healthcare, seek a healthcare. So people were encouraged to get their vaccine, which is really important to keep in mind. The way vaccines delivered in Australia is through provider offices, pharmacists, and then occupational health. And in all three of these different venues, they found creative and effective ways to immunize folks in a safe manner. So you see that some of the pharmacists would have clinics outside, GPs or primary care physicians would host clinics in their waiting room or outside again in the yard. Some places would have pull-up drive-throughs with people would actually still be in their car and receive a vaccine. And then schools were utilized as another area where people could be social distanced and still get their vaccine. So they implemented many things many of us have probably heard, where you're experiencing now. You'd come up and call or text and you'd let the provider know that you're there, and the provider would give you instructions on where to go and what to do. You'd get your vaccine, you'd wait for the amount of time that was required by the provider, and you'd move along. And so that's some of the ways that they were able to manage safe vaccination during the pandemic. So as you can imagine, similar to the run we saw on toilet paper earlier in this country, there was a run on influenza vaccines in Australia. This was a year that was very, very different from the past, because many people reported that they took a vaccine where they never had before. So there were some little skirmishes and squabbles about which state got vaccine and how quickly they got vaccine. But I think one of the things to keep in mind is the government was very communicative and worked very closely with state and local to make sure that if the vaccine wasn't readily available, there was a timing of when that vaccine could be available. You can imagine there were also cases where people were emotionally, upset and had some challenges with that. But key here again is that conversation and that communication among all stakeholders, including the industry, who was delivering the vaccine. So the government was able to mitigate all this by, again, through effective and consistent messaging, trying to understand the expectations about timing of doses and availability of doses. They did end up ordering an additional number of doses to reach the levels that they had achieved. And they work with manufacturers to make sure that the timing and availability was understood so they can communicate that to the providers in the states. So to that end, the vaccination uptake, they report uptake in terms of the number of doses procured. So the government ordered 18 million doses this year, which is up about 5 million doses from last season. So if you look at that and you look at the number of doses that they ordered over and above last year, it's a 36% increase. So we were hearing reports that almost all of the vaccines been used. And that's really, really great because it's the one way we're going to avoid the double whammy by reducing the burden of respiratory disease. So in the end, the public responded well to the flu vaccination campaign, and they started the campaign earlier and extended the campaign well throughout the season so that as many people could get vaccinated as possible. And I think that there's genuine consumer demand, and that was generated through the communications by the government and other stakeholders, and the availability of vaccine extended through the season was really important. So I'm going to leave it at that and wait for any questions. Thank you.
Great. No, thank you, Heather. I think having that perspective going right before we go into our season from Australia is extremely valuable. Avoiding this pandemic is important. So with that, I think I'd like to invite LJ Tan to make some opening comments as well from his perspective and what he's experiencing right now. And I know LJ, yeah, go ahead.
Hi, thank you so much again for the opportunity to participate in this panel. Great discussion already. Great presentation, sorry. Just a quick, I'm the Chief Strategy Officer for the Immunization Action Coalition, but I also co-chair with the Centers for Disease Control and the Department of Health and Human Services, the National Adult and Influenza Immunization Summit. So just want to say that any perspective I provide today reflects my personal expert opinion. It does not necessarily reflect the opinion of the CDC or HHS. Before we talk about flu, I just want to mention that, and this is what's troubling, right? Because while we hear demand for flu is up, we are also still very, very cognizant of the fact that because of COVID-19, there have been significant declines in adult immunization coverage rates, and those declines have been widespread and across all vaccines and all risk groups, right? So we've got multiple 67% decline in herpes zoster, 88% reduction in PCV13 in VAs, and we do know that increasing COVID-19 locally, regionally leads to decline in adult immunization coverage rates. So we need to keep this in the back of our head because localized planning will obviously be key to address these different situations and differences in timing, and this is true for flu. And then we also want to keep in mind that while we've always heard in the media that the impact on pediatric rates were also dramatic, they are beginning to recover. I think it's important to point out that the adult immunization coverage rates are not recovering. They're not recovering the same rate as with pediatrics, and importantly, adult catch-up vaccination remains absent. So in other words, if you missed a vaccination as an adult because you were sheltering in place over the spring, those folks aren't coming back to catch up on those vaccines, and so large numbers of adults remain under-immunized. So how does that all play into flu? Well, we do not know, but especially since we're hearing about the increase in demand for flu vaccination. But I think we need to keep in mind that one of the reasons, many of the reasons why these adult vaccination rates remain low is because of the decline in wellness visits that we've seen from all ages of all adults, and we have not seen recovery to pre-COVID levels for that yet, and also a decline of ambulatory care visits, which are still 33% below the pre-COVID-19 levels. And those are visits that we know where people get vaccinated. So I think we want to keep those in mind as we go forward and think about my favorite hashtag, which is hashtag avoid the twindemic, translated to hashtag take flu off the table, right? And why are we talking about that this coming fall? I think again, because of those plummeting immunization rates, because of some of the challenges we know we're going to see, and we also are aware that the overlapping high-risk conditions between influenza and COVID-19 makes it absolutely critical that we do vaccinate against the vaccine-preventable diseases such as flu, for which we actually have a vaccine. So we don't have a vaccine against COVID-19 right now, but we do have a vaccine against influenza, and so we need to take flu off the table, right? Because we know that if we get that twindemic of flu and COVID-19, that will not only create morbidity, mortality, and cost burdens on the individual, but it will also create the same challenges for our healthcare system and will create surge capacity issues for those healthcare systems. We all have been talking about surge capacity, right? We all know about, from this spring, what we've been trying to do is to reduce the capacity of people going into ERs, occupying ICUs, occupying hospital rooms, examination rooms, because we know COVID-19 is going to continue to create that stress on the system. What we do not want now is to put flu on top of that. And so we have a vaccine against the flu. We want to hashtag take flu off the table. And as you heard, how do we do that? We heard from Heather, right? Australia, we need a strong, unified national message that we need to have people seek flu vaccination, even if they're under quote-unquote shelter-in-place social distancing instructions that are going to vary from region to region, as I said earlier. We need to make sure that the national message continues to stay strong, that regardless of what your region is doing, there is a reason to seek flu vaccination. And that these flu vaccination messaging efforts will have to be accompanied by strong, reassuring messaging that COVID-19 safety is being handled by the access points that we're asking these people to go get vaccinated at. And so what about these access points? We already heard from Heather, so I'm not going to spend a lot of time here, but we need to explore some of these innovative approaches to increase access to flu vaccines and, as a result, to all adult vaccines. So we already know that some of these alternative delivery approaches are already happening, right? So things like drive-through clinics, immunization clinics under large tents in parking lots where social distancing and masking can be respected, right? But these best practices must also be shared and expanded to make vaccines such as flu vaccines, widely available, and to reassure the public that, of course, their safety is being taken care of. And then we also need to assure the provider that when they're doing these innovative approaches that cost more money, we can figure out ways to build that into provider payment. And then finally for flu, what I want to mention is that the vaccination season has to be expanded, not just extended. So while we have optimal months for vaccination, September and October, right, as specified by the ACIP, we need to figure out how to reassure our clinicians that they should be using their clinical judgment. So, for example, if a patient comes in August and you're convinced this patient is not going to be able to be seen by the healthcare system again, you need to use your clinical judgment and provide that flu vaccine. So I think we need to reassure our providers to be comfortable, all right, with that flu vaccine. And finally, I want to point people to to an IAC repository that we have created that hopefully will share some of these best practices. I'm not certain if I can share my screen, and I can, so this is awesome. I'm going to show this slide, and then hopefully all of you can take a look at this. And this slide that you can see up here is essentially the link to our immunization repository. I'll be happy to also put this in the chat box for everybody as well. And what it is a gathering of all, I think my sharing told me told me that I was going to crash the system, so I just stopped. Can you also hear me? Nod if you can.
I can hear you. Yes, we can
awesome.
hear you.
All right.
You could also try canceling the share and then try resharing it. It could have just been a blip too.
Yeah. Okay, let me do this. I'm going to try to cancel the share. Okay, I'm back. Sorry about that. Okay, so that was the resource. I'll put the link in the chat box, but that also was my last slide. So thank you for that. And again, these were best practices for how we can do these mass immunization clinics. How can we do these innovative access to flu vaccine during the time of COVID?
No, I think that's great. And I think that's also, in a time when morale and mental health is also a concern, providing these types of innovative connectivity from a distance, even for, the good of vaccines on top of that, it certainly doesn't hurt on other fronts too. So thank you for those suggestions and great remarks. So I'm going to turn to Amy now, who's with BIO, the Biotechnology Innovation Organization. And, you know, Amy, I'd love to hear some opening remarks, and even if it's some reactions, comments, or even a policy perspective. I mean, you do sit in DC, and we're definitely coming from a different perspective than the other speakers. So, Amy?
Yeah. Thanks, Maria, and thanks to Georgia Bio for organizing such an important discussion. Like Georgia Bio, BIO is a trade association for the biotechnology sector. Our more than 1,000 members around the world are working to find solutions to today's biggest human health, food and agriculture, and industrial and environmental challenges. And we're proud to have great state partners like Georgia Bio all around the country. Our members include manufacturers of both seasonal and pandemic influenza vaccines, as well as companies working to innovate and improve the efficacy and durability of flu vaccines towards more, quote, universal protection against influenza. And while COVID has definitely garnered a lot of attention and taken over a lot of the capacity of BIO this year, you know, influenza is a threat that we predictably face every year, and we want to be prepared. Seasonal influenza is a leading cause of death from infectious disease, and the threat of pandemic flu is kind of always looming. The other panelists have already touched on kind of what we're seeing this year, and so I thought it might be helpful to take a step back and put this flu season in some context of previous flu seasons. So despite the threat and a universal recommendation for vaccination against flu for everyone over 6 months of age, influenza immunization rates still trail behind those of other vaccines. And over the past few seasons, the CDC estimates that only between 40 and 50% of Americans receive an influenza vaccine. And among different subpopulations and different age groups, these vaccination rates are even lower. And these low vaccination rates are due to a variety of factors. Some people just aren't aware that there's a recommendation for all people above 6 months of age in the US. Some people have a belief that the flu disease just isn't that bad, and getting the flu, they'll just bounce back in a couple days. And then there's some hesitancy specific to the flu vaccine itself. People feel that the flu vaccine isn't as effective as other vaccines, or there's a lingering belief that the flu vaccine gives you the flu when it doesn't. And so despite these low immunization rates, flu vaccination does have an impact still. The CDC estimates that during the 2017 to 18 season, which had an unusually long duration of high influenza activity widespread throughout the US and high rates of outpatient visits and hospitalization, flu vaccination prevented an estimated 7.1 million illnesses, 3.7 million medical visits, and 109,000 hospitalizations and 8,000 deaths. There's also a protective effect in lowering the severity of disease and shortening the duration of the disease. And so increasing these vaccination rates could have a great impact on individual and population health. And so this year, with the flu season coinciding with the COVID-19 pandemic, if we have low adherence to public health measures like social distancing, masking, and flu vaccination, we could be facing this twindemic, as LJ has said. And so, you know, with these, the decline in routine immunizations that LJ talked about, it's even more important that we communicate the importance of flu vaccine this year. And, you know, in a time when we all may feel a little bit powerless, flu vaccination this season provides an opportunity for individuals to take action to protect themselves and the healthcare system and essential workers. And few cases means that the healthcare system capacity is preserved for fighting the pandemic. And so, as Michelle said, it can also be a trial run for the COVID vaccine rollout with new models and distribution channels, messages, outreach to populations that typically have low vaccination rates. We're facing a mass immunization campaign on a scale that we've never seen. And so we want to make sure that that infrastructure for distribution and outreach is there, and we have a great opportunity to test that this year. And so as BIO, in advance of this flu season, we've been trying to serve as a conduit for communications between CDC and manufacturers, we've been working with our vaccine members and other stakeholders to coordinate those communications about the importance of influenza immunization, and of course, advocating for congressional appropriations to support the efforts of the CDC and state and local health departments for flu season preparedness and communications, as their capacity has really kind of been decimated by responding to COVID over the past few months. We want to make sure that those public health partners have the people and the infrastructure and the resources needed for these routine immunization activities. So we're really proud at BIO that our members have really been proactively stepping up to meet the challenge of this upcoming flu season with increased production, to meet the increased demand, and to aid stakeholders in messaging about the critical importance of flu vaccine this year. And so, it's already been said, well, I'm sure we'll say it many more times during the discussion, but we have the tools to prevent the convergence of COVID and flu this year, and getting a flu vaccine is more important than ever. So I'll stop there and look forward to the discussion.
No, great. Thank you, Amy. I think that's important, and thank you for BIO's leadership up on the Hill to make sure that our states can be as prepared as possible and get the support they need. So I know we have a few things I want to turn back to a little bit. So I think one of the key things, if I look back to Heather's remarks, are flu season like this year is coinciding with lockdowns and social distancing measures in Southern Hemisphere countries, and making the actual flu disease burden relatively mild in those countries. But as we approach our season in the Northern Hemisphere, how useful is that data? We have cultural differences and, other social challenges around this. And are we really walking into a flu season pretty blind if the same public health measures for the pandemic are not in place here this winter? Heather, your perspective, anyone else wants to jump in?
Yeah, I'll just really quickly say, I think the thing that worked really well for Australia was the consistent messaging from key leaders. I will say, excuse me, we are hearing from CDC. I think a lot of the efforts are going to be placed on the states to really have strong messaging and consistent messaging. And I also will kind of punt it to LJ, but I think the Immunization Action Coalition and Flu Summit has a really, really important role to play here, as well as the other associations that help drive influenza uptake. So I think that really, if I had to think about one thing that worked really well in Australia that we need to really be mindful of, is that constant communication and encouragement to get the vaccine.
I'll jump in really fast to kind of address two parts. There's a two-part to that question. And the first part, obviously, is the data of surveillance itself. And I think that's one of our challenges, is that we do know that influenza, the way epidemiology of influenza in the Southern Hemisphere does not necessarily reflect how it's going to show up in the U.S. I mean, even within, just within the North America, between Canada and the U.S., we already saw differences in the way strains were circulating. There was H3 in Canada, there was no H3 here. So I think it's in terms of the disease itself, I think every flu season is a flu season. But with Heather's point, I think messaging and social behavior, there is some constancy there, and I think we can learn from the Australian experience about a unified national message assuring availability of vaccines, safety of getting immunized during COVID-19, and essentially saying that, this is something you can do to help yourself and to help your community while we do not have a COVID-19 vaccine. I think those kind of messages actually will work, and I think that's what we need to kind of look at. I do know at the summit, which Heather kind of talked about, we do start our weekly phone calls, and during these weekly phone calls, the CDC provides updates on messages. We've already had 2 meetings where we've had 2 presentations from the CDC on how they're going to influence the messaging this year, recognizing a lot of it's going to be focused on chronic ill as well as high risk because of that overlapping population with COVID-19. But that being said, I think we need to realize that I think the message is going to be, how do we continue to reassure people to come back out and get vaccinated for flu, because it is important. And I think and providing those access points.
I can jump in just a bit as well. One of the things that you see in the Southern Hemisphere that they also did really well was community mitigation. When I talk about community mitigation, it's kind of thinking about the way in which you prevent the spread of any type of respiratory infection, washing your hands, wearing masks, continuing social distancing, and utilizing vaccination. And so those communication messages are key. I agree both with LJ and Heather. Having that national campaign is amazing. I would only add that there are communities where you do see pockets of lower vaccination. And so taking those national campaigns and ensuring that we also look at it from that local level of how we are also engaging some communities, ensuring that they have the confidence in the vaccine and ensuring that they are also looking at vaccine uptake at the local level would be an additional, approach to being able to support that national campaign. So I would very much emphasize that community mitigation that we saw so well in the Southern Hemisphere, that campaign, and also just including additional localized and very much more targeted messaging for some communities in the US.
Great. No, thank you for that. Definitely. So, and again, y'all touched on some of these comments, and this is going back to Michelle a bit, but and LJ. But what else can public health and vaccine manufacturers and other stakeholders still need in order to fully prepare for flu season vaccination campaigns and communications efforts? And what resources do y'all have available for states?
Michelle, why don't you go first on this?
Or you got it, LJ?
You guys have got to stuff, and then I'll come in and just re-mention the repository.
Oh, there we go. Yeah, so absolutely. Again, one of the things that NACCHO is trying to do is really ensure that we are providing various materials and tools virtually, right? So we're all also working somewhat virtually. So webinars, ensuring that we have experts in the field coming to the community, providing their insight, as well as having other health departments speak to our network, talking about best practices, talking about actions that have been implemented, talking about things that have worked within their communities. We know that that's a lot of value that health departments see when they learn from one another. We have stories from the field. We also are updating some of our toolkits. We have a school-based influenza toolkit that we are updating this year. So we have a whole host of resources on our website, really geared to health departments related to administration and also communication. We also think that talking about vaccine confidence is going to be really key as well. So really supporting local health departments in their messaging to their communities.
Oh, I was on mute. So the other thing, the repository that has already been sent out by Christina, we are also in the process at IAC with support from Securus, actually. We're finalizing a website called the Mass Immunization Clinics website, and what we're trying to do with that website is gather best practices very specific to mass immunization clinics for flu, and hopefully that will help provide some more background and best practices. As part of that, we're also going to be holding a virtual meeting probably sometime right around October to kind of capitalize on first the NFID launch and then to kind of create legs to launch actually this website. But at the same time, we also hope to use that virtual meeting to capture some individual best practices from state health departments and other locations where we can innovation as well. And then I think the other thing I want to point out is that I think the use of mandates is becoming interesting. Obviously, we know healthcare professionals have always had a mandate for flu vaccination, but I think it's delightful, and Michelle may have some comment on this, to see universities and colleges beginning to implement flu mandates for their college-age students. And I think that, especially for this year, that's a really good message to be sending.
Yeah, actually, LJ, I'm glad that you brought that up. One of the things that I really love about IAC is you also keep mandates around school vaccination mandates as well. And what we just saw in Massachusetts in terms of mandates for all school-age children is going to be huge. And so I think right now there's probably about 7 to 8 states that currently have mandates for children. But then also thinking about what mandates look like for healthcare personnel and those who are providing services to those most at risk, whether that's elderly or folks who are just providing clinical services in general, ensuring that folks get their flu immunization shot, who are providing these kind of key essential services as well for our folks.
Oh, that's great. So You know, we have some questions, LJ, you've already touched on, but is there any other emphasis you want to put on why it is so important that we avoid this co-infection with flu and COVID-19, your hashtag avoid the twindemic?
Yeah.
I mean, I don't think we can say it enough, and I think it's one of those updates we're going to have, but, you know, any other, I want to see if you need to drive this home anymore.
So I can drive it home one more time just by summarizing what I've said, and I'm sure others have things. I think 2 points, individual level, right? If you're vulnerable with chronic illness or elderly, you do not want to catch COVID-19 and flu. We can't take flu off the table, but we can't take COVID off the table, but we certainly can take flu off the table. So that's the individual impact. Then as a community and as healthcare system surges, right, we want to make sure that we can protect our healthcare system from the emergency room surges, from the ICU surges that we'll see from COVID-19 and not add flu on top of that. And that by itself will also indirectly protect the community as well. So those are the 2 big points, right? Your community, yourself. I mean, what else can I say?
Yeah, no, that's fair. Amy, I'm going to pivot to you a little bit here. So looking beyond this upcoming season, how might the COVID-19 vaccine development process help with developing improved flu vaccines in the future?
Yeah, so I think that, you know, a lot of the technologies that are being tested for COVID are new processes, and currently flu vaccines are typically made in eggs, and that takes time to grow the virus in the strain in the eggs, and it's a relatively long process. We select the strains for the flu season in March to prepare for flu season beginning in September, October. And so, you know, our companies have been looking at ways that they can condense that timeline and make it so that we can select those strains a little bit closer to the actual flu season, so we can be a little bit more responsive to what is actually circulating at the time, as well as providing longer duration. And so I think that some of these technologies that are being tested for COVID could potentially have that quicker manufacturing process. And so it's still kind of being tested for COVID, and we need to see if that's translational to other diseases as well, but I think that there's some promise in that. One other thing that I'm personally really excited about in kind of the innovation space are kind of novel technologies for vaccine administration. So there are a number of companies that are working on microneedle patches or tablets for vaccines. And so I think that we see a little bit of hesitancy related to the actual needle part of the vaccine, not the fact that it's a, you know, protective, preventive service itself. And so I think that those innovations could really have an impact in boosting vaccination rates and kind of taking away some of those hesitancy concerns that we frequently hear.
No, thank you for that. And I'm not sure if she's on, but we have a member that has a pretty successful device, Buzzy, that is purely around that fear of needles. And actually, I own one. So, and I did purchase it. It wasn't given to me for my own fears of vaccines. So I think that is definitely something that we can't ignore. LJ, did you have a comment in?
Yeah, I jumped in because I was about to say this idea that, you know, in the flu arena, that's the one arena where we hear about vaccine hesitancy, right? And what's interesting is that as we think about that, and if you've looked at the recent public opinions on COVID-19 vaccine, there is an incredible overlap of how the same fear about flu vaccine comes into COVID-19. One, if you look at the NORC study, one of the second most common reason for not wanting the COVID-19 vaccine was fear that it would give them coronavirus. Does that sound familiar? I mean, I think we need to be paying attention of these overlapping concerns of flu vaccine hesitancy and COVID-19 vaccine hesitancy, because that's where it's spilling over and kind of enmeshing. Because normally in adult vaccines, like if you think TD and you think hepatitis B or you think zoster, there's not that kind of vaccine hesitancy among adults. It's flu. And flu and COVID-19 are beginning to kind of mesh. So I think it's interesting how that's happening. So we want to pay attention to that.
Yeah, and I don't think we have time for it, but there, you know, the herd immunity potential is, we'll see. But, well, you know, I think we covered a lot here today, and I do think we touched on a number of the questions that we collected, but Are there any final comments from anyone that you'd like to make that you didn't get a chance to voice anything around? And I will note that this was recorded. We do provide this on our YouTube channel, and we do have people go in and watch this after the fact. So I think there's a lot of useful information. We will be pushing this out to make sure others can hear and learn about that information. Additionally, I would be very interested in getting, I mean, we have your repository link, but a few things, Michelle, you and LJ noted that you're putting together best practices. I think there are a number of groups we could share that with here in Georgia at a state level, and make sure also our colleagues around the region get access to that as well. You know, the more help and information and best practices we can share, the better. But any final comments from anybody?
I'll just jump in and just make sure everybody's aware that this year, almost 190 million doses are being brought into the market. That's the word that everybody uses all the time. It's unprecedented. I mean, this is an enormous amount of vaccine that's available to the United States public. And it's not going to be any easy effort to get those vaccines into people's arms or noses, to be fair. And to that point, there are multiple different types of vaccines available. There's some vaccines available for people who are over 65 that are designed specifically for those individuals. There are vaccines that are given through the nose, and there's vaccines that are non-egg. As Amy noted before, there's different technologies that are available. So I think it's important that people understand that they have options, and that within those 190 million doses, they'll be available throughout the season and probably well into early 2021. So it's not too late to get vaccinated in early 2021, and we need to keep that in mind and be thoughtful about that.
Yeah, just jump in quickly. On sorry, Maria, on Heather's point on that one, extend the season, right? Because we see flu vaccination plummet right around Thanksgiving. And I think it's important to recognize that the bulk of these doses, the 190 plus million doses, they're not going to come out like in one batch, in one bolus in September. Right, they're going to come out throughout the course of the flu season, because that's how manufacturing happens, right? And we need to make sure our providers understand that, and our public understands that. So it's a persistent, continuous effort into January and February. And, as long as flu continues to circulate, you can continue to vaccinate, because some of these doses aren't going to show up until November. So we don't want people to kind of get frustrated or get the wrong idea, but we need to tell people now so that we know it's about expanding the vaccination season.
Yeah, Michelle, you're nodding. Did you have anything, or Amy?
Yeah, I would just add that, even if you're work from home or school from home for the next couple months, it's still important to get a flu vaccine. And if you typically rely on your provider or your employer's flu shot day or school flu clinic, there are plenty of other options with pharmacies and your primary care provider to get that shot this year.
Yeah, and just finally to kind of add, and just echoing what everyone else is saying, we all know that getting the flu shot this year is incredibly valuable, important, and I believe that vaccinefinder.com or vaccinefinder.org is also an available website. I'm going to try to get that into the chat box before we leave today, but that's also another methodology to find a vaccine for anyone who is looking for one. And that's vaccinefinder.org.
Wonderful. Yeah, and I'm dropping it into the chat as we speak for all the attendees. So that is great tips. I think, Georgia Bio will do like it did last year. Unfortunately, we can't meet in person for our summit, but we will at least try and do our best to get the messaging out at the very least. I'm very curious, as Christina knows, I've been texting her. I'd like to see how we might explore providing one of those innovative flu vaccine locations leading up to our annual conference, because normally last year we hosted a service that came in and actually offered flu shots during our conference. So I think, I think those are some creative ideas that associations in particular and other groups like us could offer to their members if they're so inclined. So that's something we can definitely explore. We will follow up with attendees with the recording, the numerous links y'all shared, and then I'll likely follow up with you, Michelle and LJ, in about a month to see about that repository. I think that's going to be really valuable for a few of our programs in response to COVID. So thank you for that. Well, without any further ado, I'd like to thank all of our speakers. Thank you again for your time today. And I know you're very busy, and I appreciate you taking a few minutes away from meetings with WHO, the WHO, and other important groups that we need to have at the front lines right now as we battle COVID-19 and the impending flu that we have coming too. So please stay safe and well to all of our members and our partners and to everyone on this call. So thank you again, everybody, and have a great day.
Thank you.
Thank
Be
you.
safe, be well.